Today we are going to talk about aminoglycosides. Aminoglycosides are one of the most commonly questioned medications in the NCLEX-RN exam. Aminoglycosides are antibiotics. Very powerful antibiotics. Everything that I am going to say in this video came from Mark Klimek, one NCLEX-RN reviewer that is very good. I like the way he presented this, so I'm just basically gonna copy how he did it. But search him up, he's really good. When you say aminoglycoside, I would like you to think of aminoglycoside. Remember, aminoglycoside. So why remember aminoglycoside? From aminog, this means that this antibiotic is very powerful and is meant to be the last defense because of how powerful it is. Aminog will only basically be used for life-threatening diseases or bacterial infections, serious, resistant, and gram-negative. But what exactly are those serious, resistant, gram-negative, life-threatening diseases? So basically, if it's from a bacteria, think of this. Sinusitis is definitely not. You don't give aminoglycosides or aminoglycin for sinusitis. Not for otitis media. Bladder infection? No. Strep throat? No. Viral pharyngitis? No. Tuberculosis? Yes. Septic peritonitis? Yes. Septic shock? Yes. There are so many different types of aminoglycosides, so one good way to remember is that all aminoglycosides end in mycin. This is why we are saying aminoglycin. Also take note that not all drugs that end in mycin are aminoglycosides. Bummer. But you only have to think of three drugs that end in mycin that are not aminoglycosides. These are erythromycin, azithromycin, clarithromycin. Now think of the common word between these three medications. Do you hear the word throw? Erythromycin, azithromycin, clarithromycin? If you hear the word throw, then throw it out. Because although they are antibiotics, they are not aminoglycosides. They are for like sinusitis. That's good for that. But every other mycin that doesn't have a throw are aminoglycosides. Examples of aminoglycosides are gentamicin, amikacin, tobramycin, kanamycin, streptomycin, neomycin, and so much more. Remember how I said aminoglycosides, think of aminoglycin? When you hear mycin, what do you remember? I would like you to kind of think of mice. And then the most popular cartoon mice, what is the most distinguishing feature? It's the ear, right? So that's why you have to remember that aminoglycosides has a toxic effect that affects the ear. It's called ototoxic. The three things that it affects on the ear are, number one, hearing, Number 2, ringing in the ear called tinnitus. And number 3, dizziness, also called vertigo. So you know what they say, that however big your ear is, that's also how big your kidneys are? When you remember ear, also remember kidneys, because aminoglycosides are also nephrotoxic, or it affects the kidneys. So what's the best thing to do? Check the creatinine level. That's the best way to check the kidneys. It's the best indicator of kidney function. Well, actually, there's one more that's even better. It's the 24-hour creatinine clearance. Everything else is a distant third. Now, when you think of ear and kidneys, think of it being cut into half, and then basically, you know how they're both shaped the same? If you put one half of an ear and one half of a kidney together, it would form an 8, right? So remember the 8. Why? Because this medication has a toxic effect to cranial nerve number 8. The medication you also administer every 8 hours. You can administer aminoglycosides IM or IV, but not oral. There are only 2 exemptions to oral administration of aminoglycosides. One exemption is if the patient has hepatic encephalopathy. So if you understand this disease, this is with a lot of ammonia, right? Well, the number one producer of ammonia is actually E. coli that can be seen in our stomach. So that's why it's good to give aminoglycosides orally, so that it will kill the bacteria E. coli, which will lessen the production of ammonia, because aminoglycosides kill E. coli, which causes more ammonia. Another exemption to giving aminoglycosides orally is on pre-op bowel surgery. Why? Because it is an antibacterial and it will basically clean or sterilize that bowel. It's better than enemas. So yeah, you can give aminoglycosides 2 days before bowel surgery. So if you give aminoglycosides via oral method, you won't really have to think about the ototoxic or nephrotoxic effect, because it isn't really absorbed in the blood. Unlike giving it IM or IV, it will go straight to the blood. Now if you give it orally, it will basically be just pooped out. So there are only 2 aminoglycosides that can be given for bowel sterilization. It's neomycin and kanamycin. According to Mark Klimek, you should remember the cadets. You know how the military, I don't know what I've been told, things like that, right? So imagine that the military officer, while marching on the road, asks, "Who can sterilize my bowel?" And then the soldiers will answer, "Neo can." Neo can. You get it? Get it why? Because neomycin and kanamycin are the 2 drugs that can be taken orally to sterilize the bowel. That is basically everything that's going to be asked about aminoglycosides. But remember, amine old mycin. So once again, amine old mycin is for serious, life-threatening, resistant gram-negative bacteria. Not all medications that end in mycin are aminoglycosides. So think of throw erythromycin, azithromycin, clarithromycin, throw them away because they are not aminoglycosides. They are the more weak antibiotics. When you think of ear, also think of kidneys because of the nephrotoxic effect. Anticipate the doctor ordering creatinine test. Now, ear and the kidney equals 8. So think of toxic to cranial nerve number 8. Administer every 8 hours, IM or IV. Do not administer orally except for 2 conditions, which is hepatic encephalopathy and pre-op bowel surgery. No ototoxic or nephrotoxic effect for oral, and the 2 medications that can be taken orally are neomycin and kanamycin.